Hi everyone, this is Isabella again. I'm going to be presenting woman genitalia assessment. But before we start anything, I'm just going to ask the patient history. And this patient doesn't have any allergies. She of course gave me her age, and we spoke about the I did the assessment about the family histories and everything, and then I did ask about the experiences of any genital urinary diseases of which she doesn't have. I asked about her sexual habits and what she uses for contraceptives. She has an IUD on. I asked her birth, and she has 3 kids, no miscarriages, nothing like that. And then I did ask about any history of inguinal femoral hernias, and she's never had any. And then any birth defects, she never had any. And actually, her 3 kids, she had them vaginally without any complications. So I'm gonna go ahead and do the exam or the assessment. To begin with, I'm gonna put on my gloves because we are dealing with body fluids. We're gonna assess the pubic monas up here and see any distribution of hair. If the hair is fine, cause it's normally cause, and if the lady is a little bit older, it can be fine. And then we can check for any hygiene, any lesions, any breakdown, any skin breakdown, and the condition of the skin up there looks good. And then we're gonna inspect the vulva of lesions, edema, color, or discharge. You can open it up and assess it. You shouldn't be having any discharge, anything like that. And then we can inspect the clitoris. Clitoris, it's normally we're gonna inspect the clitoris size and shape. It's normally 2 centimeters length and 0.5 centimeters width. And then we can expect the urethral area down there where they're peeing from and over, and note the color and presence of any discharge. It's normally pink with no discharges. And then we're gonna inspect of course, the vagina, the inside of the vagina. I'm gonna go ahead and palpate the pylori glands for any masses or anything like inside the vagina. That's why you palpate and check it for any tenderness. If there's any tenderness, then or edema, it can indicate that the patient has an abscess. And if there's any mass, it can indicate that the patient have cancer. And then you can refer that patient to the specialist. So you can just go inside the vagina and try to palpate in the vagina. And then we're gonna of course inspect the internal genitalia using a spectrum, where I don't have a spectrum with me, but it just comes close like that, and then you have to put it on a 45-degree angle and then rotate it back to lay flat, and then to open it you can expect it up. And then that's when you'll be able to assess the inside of the patient's cervix. And the cervix should be normally be smooth and round and pink. But if the patient is pregnant, he can be having like a bluish hair color kind of thing. And then after we did that, we didn't see any lesions or anything like that. And then we're gonna perform a bimanual exam, where we're gonna palpate of the internal structures of the patient. And then you can just go in with your 2 fingers and feel. As I say, you can palpate. And if you're trying to check for the ovaries, you just hold one side and go with your 2 fingers and then push it down, and then you can feel the ovaries on your side, on both sides. You do like that. And after doing that, and then the area of the genitalia area will be done with the assessment. So I'm gonna take my gloves off, and then I'm gonna move on to assess the breast. Of course, now cover the patient from the back, and then we're gonna go up here where the patient's breasts are and uncover the patient and check the symmetry of the breast. Most of the time, actually, our breasts are not the same size. One may be smaller than the other one, but not like a significant amount of size. But it's normally one side is smaller than the other side. And then you can check the areolas part, and check the nipples, see if this breast are symmetrical, and then see the skin around the breast. And then now we already assess for their size. And then you can assess if they've ever had any breast implants or anything like that. You can check for scars or anything like that in the breast, of which this patient doesn't seem like they have any scars or anything, and they've never had any breast surgeries. And then we of course we check the skin and looks all with it's a same complexion with the patient. And then we're gonna go ahead and palpate, and then with palpation you start from the bottom, and then you can go like anti-clockwise or clockwise, and we are checking for any bumps in the in the breast. And then you can do the same on the other breast, going clockwise and anti-clockwise. Check for any, if the breast should be any tender or anything like that, not unless maybe this person maybe early pregnancies can cause tenderness, but other than that there shouldn't be any tender even when you're touching the breasts. And then you can check for discharge by just like pushing on the nipple. Check for if there's any discharge. And after you've checked and make the patient feel comfortable, ask the patient if they have any questions for you. If there's no question, then you should encourage the patient to be doing these breast exams each morning or every month whenever they are taking a shower. And if they come up with if they find themselves having like a lump or anything like that, they should be able to check in with their PCPs, and who will be referring them to for further examination. Thank you so much, and that's the end of my video.